Welcome to the Bismarck Cancer Center podcast. I'm your host, Dana Hager, Education Outreach Services Coordinator at the Bismarck Cancer Center. In this podcast, we'll share stories of hope, health, and healing, and learn more about the people and technology behind the scenes at the Bismarck Cancer Center. Today's guest is Dr. Cole Kreofsky, Radiation Oncologist at the Bismarck Cancer Center. Welcome, Dr. Kreofsky. It's nice to have you here. I have heard a few people call you Cole, and I know you've told me, call me Cole. What do you prefer to be called?
I've always liked being called Cole. I've always felt very informal and want patients to feel comfortable. And so for me, Dr. So-and-so is the professors who taught me.
Old guys that taught you, right?
Exactly.
So you, even with your patients, you don't mind if they call you Cole?
No, not at all. Doesn't bother me one bit. And if they're comfortable with that, then so am I.
That's good. So you're one of the doctors over at the Cancer Center here in Bismarck, North Dakota. You're not from here. Can you tell us a little bit about yourself and what brought you here to Bismarck?
Yeah. So I'm originally from Southeast Minnesota. I grew up in a small farm town just outside of Rochester. And shortly after graduating high school, I moved to Wisconsin, to Madison for the University of Wisconsin there. After graduating from college, moved back to Rochester for a few years, did some research in preparation to go to medical school. And then I attended medical school in Detroit, Michigan, which for me was never originally on my life plan or radar. But when the opportunity presented itself, Detroit, Michigan was a very different climate, a very different experience from what I grew up in rural Minnesota. And so I thought it would really be a neat opportunity to live in an urban area, be in a very diverse population of people, both overserved and underserved from a healthcare perspective. And in my 5 years that I lived there, it really truly was a good experience to see something outside of what I grew up in, outside of what I would have considered, called my comfort zone.
Your normal.
And that was a really valuable experience for me. And there I met my wife. And so we were shortly married, and right before moving back to Minnesota, where we did residency in Rochester at Mayo Clinic. And then after a few years there, had the opportunity to move to Bismarck to join the Bismarck Cancer Center as one of the radiation oncologists there.
Awesome. So you gave us just a nice overview of how you got here. I want to back up. You said that wasn't really the plan. So was your plan not to go to medical school, or did you always know you wanted to be a doctor, or how did you?
Well, this is a long conversation.
Oh,
but
gosh.
No, the short version is I grew up near Rochester, and I was always just enamored and excited about the Mayo Clinic. And I used to read the biographies of the Mayo brothers and was just kind of really interested in how that came to be and what they thought of as medicine. But when I went to college, I kept a very open mind, and it wasn't until the very end of college where I felt like, all right, maybe medical school or medicine is really what I want to do. So I did have a period of time there where I explored other career options and ultimately came back to what I thought was going to be something that would work well for me in the future. And so medical school. And
then the cancer route came in right away, or was that something?
Yeah, that was really, so being in oncology was something I always really wanted to do. For whatever reason, the idea of working with cancer patients, the kind of the academic study of trying to learn about cancer and figure out ways to treat it, interested me. And throughout medical school, I explored different types of oncology, namely through either medical oncology, which is the physicians that do more chemotherapy or systemic therapies, surgical oncology, or even like gynecology oncology. And, those were all interesting. And I, to be perfectly fair, didn't even know radiation oncology was a discipline. It was not something that's taught in medical school. It's just kind of something you run into along the path of multidisciplinary care of patients. And I happen to have a friend, a classmate in the year ahead of me who was going to do radiation oncology. And it was through him that I really started to pick his brain to see, what this field was about. And it really spoke to me. And so that's what I ultimately ended up pursuing and haven't ever regretted it
and
since.
We're grateful too to have you here with us in Bismarck and doing such a great job for us and for our patients too. And Bismarck, because of our beautiful warm weather and all that, is that what brought you here? I'm sure that was totally what brought you here. What brought you all the way over here to Bismarck then?
That's a good story too. Being from the Midwest, I mean, anything with four seasons is where I want to be.
Oh, that's perfect.
And so obviously the cold of growing up in Minnesota, the temperature here is maybe a little bit colder than southern Minnesota, maybe a little bit windier here, but there's still snow. There's still lots of sunshine in winter and in the summer. And it's still the Midwest. So there's a lot of great people here, a lot of things to do outside, a lot of free space to roam around and feel comfortable. So never really thought that North Dakota was that different from Minnesota when exploring Bismarck.
Good. And a good place to raise a family. I know you have children and a family here that's making Bismarck their home.
Yeah, it really is. I mean, growing up around Rochester, which is a city of about 100,000 people, it's just the right size. So it's small enough where it feels like a small town, but it's got big city amenities, and Bismarck's the exact same way. It's very safe. It's easy to get around. The idea of traffic is only happens during the first snowfall of the year. And so, yeah, it's really nice. And the people here are great. The Cancer Center is just phenomenal in a lot of ways that is unique to oncology. And so we've really found Bismarck to be a good home for us.
Well, perfect. I want to shift a little bit to your real job. And the things that you do at the Bismarck Cancer Center. So you're relatively new to practice. You started at the Cancer Center, I want to say like 2017-ish?
Yeah, midway 2017. So
which doesn't seem that long ago, but that's getting to be a few years now that you've been at practice at the Bismarck Cancer Center. Have you seen changes in treatments in that amount of time? Talk to me a little bit about what you learned at school coming in, and are things different now?
Yeah, so when I was in residency, one of the things, let me backtrack just a little bit. So traditional radiation therapy for the past several decades has always been, on average, has always been kind of a single radiation treatment or a radiation session once a day, usually Monday through Friday for several weeks. Typically, a prostate cancer treatment would be 8 to 9 weeks. Breast cancer would typically have been 5 to 6 to 6.5 weeks. And the reason for that was largely because the technology at that time really didn't allow for us to target very small areas very well. So we'd have to treat a large area and we'd have to expose more tissues to some of the effects of radiation. And so you had to give a very low dose of radiation every session. But in order to get enough radiation dose to be effective for the cancer cell, you had to break that up over a long period of time.
A huge commitment for
patients. A huge commitment for patients. Well, I mean, so because of the advances in technology, our field has really been the beneficiary of that. So the algorithms that we use now in the computer software to help design the radiation fields for each individual patient, for each individual site inside their body, the hardware, the sophisticated hardware on our fancy machines has allowed us to, come up with these radiation plans that are much, much more focused on the target of interest. And not only are we hitting the target better, but we're also missing or minimizing the exposure of radiation to the adjacent or non-cancerous tissues, our normal organs. And so by doing that, we can now often give a higher dose of radiation per session, per treatment, in a much safer way, which allows us to, in a lot of cases, shorten the treatment window down to less weeks, less treatments, and be, if not more effective, equally effective, but also safer, less side effects, less toxicity. And so that's been a huge advance to our field. And I was exposed to that in residency. Mayo Clinic was on the forefront amount of really trying to get patients treated in the shortest amount of time, because they came from all over the country, sometimes all over the world, and they wanted to get home too. And so I got comfortable in that type of environment, treating patients that way. And Bismarck Cancer Center was already doing some of that by the time I got here, but we really transitioned to a lot more of that full time in the time that we've been here now.
Good. So I'm so glad you really broke that down for me very nicely, because when you started saying algorithms, I was a little nervous that I was not going to be able to follow you. But you did a really nice job explaining that higher doses of radiation over shorter periods of time, you're able to pinpoint that cancer a little bit more detailed, giving less side effects to your patients. Like, this is such a great thing for our patients to have. And then the Cancer Center is bringing some of those therapies into this region, right, to serve our patients.
Absolutely. Yeah, the unwanted side effects had really hamstringed the field of radiation oncology for a lot of years, and it's still passed down from some patients to their friends or family, or from older physicians. I'm not picking on old physicians, but physicians who practiced a lot in an era where they saw their patients have a lot of these unwanted and long-term side effects. And so oftentimes in my role, I'm spending some of my time with patients just kind of demystifying or breaking down some of the older expectations into what is common with more modern treatments.
Yeah, so what happened to maybe your grandpa during treatment isn't necessarily what's going to happen to you during treatment because of these new procedures that you have.
Exactly.
Can you tell me a little bit more about, so I know you do something like a prostate high dose. We've introduced that at the Cancer Center. Can you tell me a little bit more about what that, for the patients, and what that does? Or fewer days for treatment, obviously?
Yeah, so what you're talking about is what's called brachytherapy. And so brachytherapy basically means you're taking the radiation and you're putting it directly into the organ or into the source where you want to treat. The two most common areas that we do brachytherapy at the Cancer Center is prostate cancer, and then we do some breast cancer as well. But specifically speaking, prostate cancer, brachytherapy has been around for a long time, and the more old way, or the original way of doing brachytherapy, was the radiation oncologist, usually with the urologist, would go into the operating room and take these little tiny radioactive seeds or radioactive pellets and place them in the prostate. It took anywhere from 50 to 100 seeds or pellets in the prostate, and these seeds would give a very low dose of radiation that would be emitted for weeks at a time. And so that was called low dose rate brachytherapy, because these seeds would be radioactive for several weeks, but a very low dose of radiation, but it would treat the prostate gland. The more modern version of doing brachytherapy for prostate cancer is a spin on that, where we still put a radioactive source into the prostate gland. And we do this in the operating room, but this radioactive source has a very, quote, high dose rate. And so what that means is we can put this radioactive source in the prostate for only about 20 minutes. And there's different ways to place it in different parts of the prostate. But at the end of that 20 minutes, then that radioactive source is removed from the prostate, and then patients are awakened from the anesthesia, and they've received their radiation treatment without having to take any of that radiation home with them, which was what
probably one of the worst drawbacks of that treatment option. Being radioactive as you left the left the facility.
There were concerns about patients while they were radioactive, traveling on an airplane or being around young children or pregnant women, and so with the more high dose rate and the radiation source is brought out of the patient immediately at the end of treatment, no one is exposed to the radiation at any point along the way except for the prostate when the seed was in there.
It eliminates that. That's amazing technology.
And then to add to that, the other benefit too is that because the seeds are not just put in the prostate gland and then left to be there, because we control where the radioactive source is during the whole course of treatment, we actually have a better way of targeting the part of the prostate that needs the radiation, but minimizing some of the areas in and around the prostate that are more sensitive. And so that has also decreased some of the side effects of this treatment. And so that's the reason we transitioned from the seeds to the high-dose rate procedure.
So do patients know about these type of procedures? Are they supposed to go into their doctors and say, oh, this is what I want? Or how do patients understand that there are new technologies in prostate cancer or breast cancer or whatever that cancer may be? Like, how are they supposed to know the best treatment option for themselves?
Yeah, so fortunately, a lot of times the patients will meet with their urologist after their biopsy to go over those results. And then usually at that time, the urologist will begin to discuss treatment options with them. So that may include surgery, radiation, or other options. And so within that radiation discussion, sometimes the urologist will introduce external beam radiation or the brachytherapy option for patients. But certainly when they get to the cancer center and visit with us as the radiation oncologist, we're going to look at their case and we're going to say, all right, within the realm of radiation options, here are the different ways that we could approach it.
So you kind of help walk them through, but you're not going to tell them you should do this. You give them choices and options.
Especially with prostate cancer, a lot of patients do have choices. So prostate cancer being very common, and in some cases it's not immediately a lethal cancer, we have the opportunity to really sit down and try to optimize what might work best for the patient. In some cases, that may be surgery. In other cases, radiation is their best option. And then what type of radiation would be ideal for them is also discussed. And so it's not uncommon to spend an hour with a prostate patient talking about radiation options, pros and cons of each approach. Again, sometimes surgery is an option for them, so pros and cons of that approach. And so at the end of the day, at the end of the appointment, sometimes patients still don't know what the plan is, but at least they know they have some options to think about, talk about with their friends and family, and then come to a decision that they feel is going to be right for them.
And you'll sit in there with them and help them come up with this decision. You'll help them through the process as their doctor and support, I guess. Yeah,
it's not always easy to be with them and say, I can't tell you what the right answer is because I don't know what the right answer is, but you want to tell them, all right, here's the right answer and this is going to be best for you. But no, my role is not to sit there and always tell them that this is the one right answer. Is to say you have good options, and so let's talk through them and help decide what might be best for you based on your priorities, your quality of life desires, and so on and so forth. So,
as you're talking about that, it's making me think about your position as a radiation oncologist, as someone who helps people treat cancer. You've been in practice now for a few years. Tell me something. What do you like about your job? I am as you sit here, I just kind of am curious. What's one thing that really stands out to you that you really like about what you do every day?
I like meeting people, and I at the end of the day, I never really thought of myself as a people person. But the more I've been in this role, I really just like to meet people and hear their story. And unfortunately, sometimes part of that story involves cancer. But a lot of times, the story happens long before that when we talk about their life outside of the cancer center. And then, if we do a treatment and things are going great, a lot of our follow-ups are just catching up on life. How's the family? Any trips planned? Or did you do anything fun? Or, sometimes we get into philosophical discussions about, raising families. I've got a lot of older patients that are grandparents now, and so they remember what it was like to be parents. And I struggle with the parent thing every day.
They see you coming in all frazzled from your children, right?
Exactly. So we laugh and joke about that. And so that's the part I like. And
really developing those relationships with your patients.
Yeah. And like I said, within the world of radiation oncology, we treat a lot of cancer patients, but not every cancer is deadly. There's a lot of cancers that we treat and patients can move on from that and have a very normal, happy life. Yes, the converse is true. There's a lot of cancers that we see that are advanced, and we have to do palliative treatments and help patients through a very difficult time. And so there are hard days in that way too. But the part of the job that I enjoy the most is just being in someone's life at a time that they need it, and try to become friends with them and learn about them and again, help them out in some way possible.
Do the best thing that you can for them, right?
Right.
Yeah. Before I let you out of here, back to the real world and to your job, all these changes in technology and everything that's happening, how do you keep up to date? How do you keep current on what's going on and what is best for the patients at the cancer center?
Yeah. Radiation oncology has always been a very academic field, and part of that stems from the fact that when we started using radiation for therapeutic purposes, I mean, that was very scary. This was right after the Cold War, and people didn't want anything to do with the word radiation.
The idea of radiation was not...
So it had to become a very academic and very learned field, and because it had to prove its worth and prove that it could help out patients alongside surgery and chemotherapy and the like. And circling back, because of that, the members of our field love to do conferences, love to teach, love to go out there and show what can be better, what can be improved. And so we as oncologists spend a lot of time going to conferences, talking to our peers, going on forums that are set up within our field, so that if I have a patient that has a very difficult situation or isn't quite the standard type of approach, you can raise a question to your peers and say, well, how would you approach this? And that works out very well. And so, but it does take a oncologist to be very proactive and say, well, I'm going to take some of my time. I'm going to go to these conferences and listen to these lectures or read the papers that come out in our journal. Go to tumor boards. So all the time, every week, we're meeting with our other oncology colleagues at Sanford and CHI St. Alexis and talking about patients and trying to coordinate things that are going to be in their best interest or help their care. And so we learn a lot from talking to our colleagues in other disciplines too, because radiation oncology is a subspecialty, but it is part of a big group of oncology as a whole, and it takes many different disciplines too to treat patients nowadays. So
teamwork.
Yeah, exactly. Yeah. And so without them, without learning their field and learning how they view the situation for patients, we'd be out on an island. So again, it staying current with evidence or papers and research that come out, understanding what used to be done and how it's done now to help kind of see where things are going and how it can be applied to today's patients is important. But that's part of oncology that is fun for us as physicians because we get to constantly learn.
Yeah,
there's never a day where things are the same. And so if you like learning, if you just enjoy keeping current, then it can be exciting too.
It becomes a passion of yours, what you enjoy. Yeah. Wonderful. What else? Anything else you want to add about Cancer Center, yourself, before we sign off?
This may sound like I was paid to say this, but no, at the end of the day, the thing that really gets me is that I have patients that constantly tell me how much they appreciate what the Cancer Center does for them, what it has to offer, the staff that is there. I mean, I work with them, I see them every day, and I know they do a great job, but to hear it from patients firsthand, and at times it brings tears to their eyes, how kind the staff are there, how thoughtful and how much they're willing to do the little things to make people feel not only at home there, but feel like their care is important. And I hear about it, patients share it with me, and it's just very rewarding to be a part of a group, a part of a clinic that really cares about patient care and has so much to offer. So, and it's things like this. I mean, it's the little things like doing podcasts to get our message out there and share what we do and share a little bit about us. So it all adds up to a really cool and unique organization.
Oh, good. I did not pay you to say that, but that was very nice of you to say. And I would just comment that, it really does start at the top, and hearing you talk about patients and how you care for them and how important their treatments are to you, I mean, that says a lot, and it starts at the top and works its way down. So that was a great little plug at the end for the Cancer Center. And Cole, Dr. Kreofsky, we're so grateful for you and everything you do for the region, for the Cancer Center, and for all the people that come through the doors there every day. We are just so thankful. So thank you for joining me today.
Well, thanks a lot for having me, Dana. It's been a lot of fun.
Thank you for listening to the Bismarck Cancer Center podcast. Subscribe to hear new episodes anywhere podcasts are found, and connect with us on Facebook, Twitter, or bismarckcancercenter.com. We'll talk again next time on the Bismarck Cancer Center podcast.